2158. That is not my number. We've got a long way to go before we get to that. That is actually the year at the current rate of progress that will see full gender parity in 133 years, or 5 generations of girls who continue to live under a system of gender inequality. Could you imagine if the leaders of the suffragette movement knew that in spite of their heroic actions, it would take another 10 generations before we achieved equality of the sexes? And that's why this year's theme is appropriate, accelerate action, because the current rate of action is unacceptable. Now, there are a number of areas that will require focus if we're going to accelerate progress, but I want to focus on women's health. Members would have heard me speak often about racial disparities in maternity care and the disproportionate rate of fatality for black mothers, and more needs to be done to address this, but the issues of maternity are now worsening for all women in this country. When I first raised the issue of black maternal health in this house, black women were 4 times more likely to die in pregnancy and childbirth. That has now reduced to just over 3 times, and awareness has played a huge role in this. So I pay tribute to 5 times more and other organisations that have done so much to raise awareness. But regrettably, most of this decrease is not because maternity services are improving. The rate of women and babies of all ethnicities dying in pregnancy and childbirth in this country has increased in the past 2 decades. Now, the UK sits in the middle to low range of maternal mortality compared to the global standard, but we really shouldn't settle for that, not for racial disparities and not for poor maternal care, especially when our maternal mortality rate is far higher than those of other high-income countries like Iceland, Norway and Finland. And it's not just maternity care where women are being failed. Women's health issues have long been overlooked, with men historically being treated as a default. Now, for many men, it's just a physical exam and a few questions to be diagnosed for something as we've heard of, like erectile dysfunction. But it takes 8 years for women to receive a diagnosis for endometriosis. That's every 7.5 seconds a man is prescribed ED medication, while it takes 8 years for women to be diagnosed with endometriosis. And we still know next to nothing about the causes of symptoms and diagnosis for the management of things like PCOS, despite it also impacting 1 in 8 women. Even periods we know so little about. Almost every person who's experienced one understands the pain and discomfort, and for many men who are still wondering, yes, a period cramp is typically more painful than testicular trauma at its least, and at its most as intense as a heart attack. And research has shown, or rather, only 2.5% of publicly funded research is actually dedicated to reproductive health, when 90% of women are suffering from these issues. Women feel gaslit by their MPs, told to go on painkillers, and there's so much more that they are not receiving when they go and ask for help with their healthcare. We can't fight for gender equality when the disparity of treatment of women's health conditions is so stark. And I don't imagine that next International Women's Day will have a complete gender equality, but I do hope that we see some concrete steps to get there with health. Thank you.